Thank you, Mr. Speaker. Minister of Health, yesterday I asked you about a report done on mental health supports and morale within AHS. And I asked if you would direct them to release that report. Your response talked about some of the things your government is doing, which is fine, but you didn't answer the question. You didn't even mention the report. Minister, I'll ask you again, will you direct AHS to release any reports with that they currently have on the state of mental health supports in the healthcare system?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I am so incredibly proud of the work that our frontline paramedics do in our province and all those who work in terms of emergency. When I talk to Albertans about EMS, they talk about how it's the scariest time of their life when they need to call 911 and wait for that help, and how much they appreciate the frontline support. And in turn, Mr. Speaker, we certainly need to give that support to the front lines as well, including supporting the path to mental readiness and increasing opportunities for mental health supports for all frontline workers. And I receive regular updates from AHS and look forward to receiving their advice on how we can continue to support frontline responders.
First supplemental.
Thank you, Mr. Speaker. Minister, I've always commended your government for the additional resources and supports for EMS, which you talked about yesterday. However, I spoke to many paramedics yesterday after question period, and they don't feel that those measures are making enough of a difference. Minister, have you read the report, and does it identify where we're failing frontline healthcare workers?
The Honourable Minister.
Thank you very much, Mr. Speaker. Again, I believe the member referred to a report that was commissioned by Alberta Health Services, so I have not received said report, but I do regularly communicate with their employers, whether it's Alberta Health Services or any of the contracted employers in Alberta as well that work with our paramedics, and I have to say how grateful I am for their frontline services and the work they do, how proud I am that our government invested $23 million more to expanding supports and expansion of those services. I understand that the caucus that asked the question, I think one person voted for it, one person voted against it, and one person didn't vote. So I have to say, where do you stand on frontline services and the people of this province, honourable member?
Second supplemental.
Minister, your refusal to share vital information with this House is troubling. Whatever your reasons for not directing the release of this report, they have to be weighed against the potential to save lives of the frontline healthcare workers. Any potential political liabilities that you may have in this report or that this report may present your government aren't worth the delay. To the same minister, will you direct the release of this report before it's too late?
The Honourable Minister.
Again, honourable member, I'm proud to work with the employers, with the unions, and with the workers that provide this important service across Alberta. I look forward to hearing advice from all parties on how we can continue to strengthen and support folks. The number one thing they've said to me is get us more resources, Mr. Speaker, and that's why this government invested $23 million additional dollars to ensure that we have the right supports. That's why this government is working with AHS to make sure that we install power stretchers in all AHS ambulances, Mr. Speaker. We're proud to work with frontline responders and to make sure they have the supports necessary, and we will continue to work to help support them in their mental health journey as well, Mr. Speaker. We've got the side of workers on this side of the House.